Larry Searight awakens each morning in Palmdale, often before dawn, to the kind of pandemic nightmare that has roiled the sleep of many over the past year. A scourge that never ends. A world that thaws and moves on but leaves him stuck and unable to keep up. Terrifying physical sensations that descend without warning and disappear just as suddenly. Friends and doctors turning away in disbelief. The mounting losses, of joy, of taste and smell, of mental firepower. For Searight, 62, this is what COVID-19 has left behind. A year out from a 2-week episode of chills, cough and exhaustion, he is at the daily mercy of a revolving array of symptoms, many of them profoundly disabling, that come and go without warning. Searight is one of hundreds of thousands of Americans, and likely millions more across the world, who have shaken off a coronavirus infection but still contend with persistent and perplexing aftereffects. Among those with long COVID, headaches, fatigue and shortness of breath are common. Problems with memory, concentration, sleep and balance abound. Athletes and fitness buffs who scarcely noticed they were ill find that, months later, they can no longer exercise due to heart palpitations, grinding fatigue and muscle weakness. Their numbers go well beyond the minority of patients who were put on ventilators, or who nearly died because their immune systems overreacted to acute infection. Patients who have sustained organ damage face medical challenges that are complex, but not mysterious. By contrast, long haulers like Searight are an enigma on many levels. Who they are and how many of them remain ill after a SARS-CoV-2 infection are unknown. What drives their bizarre array of symptoms is, as yet, unexplained. Their prognoses remain uncertain. And so is the answer to the most pressing question: how can they be helped? Their existence, however, is undeniable. Already, the pandemic has generated more than 115 million confirmed COVID-19 survivors worldwide, including at least 30 million in the United States. If even a tiny fraction of them develop long COVID, they will likely present a massive challenge to healthcare systems. One early indicator of their growing presence: hospitals in 32 states and the District of Columbia have established programs or clinics specializing in the care of patients suffering persistent symptoms after coronavirus infection. One of those fledgling programs is at Cedars-Sinai Medical Center in Los Angeles. There, Searight has found a champion in Dr. Catherine Le, an infectious disease physician who co-directs the hospital's COVID-19 recovery program. In early March 2020, Searight suffered flu-like symptoms. They seemed to have resolved by mid-April. But a few weeks later, they came back with a vengeance. A diagnostic test for COVID-19 showed he did not have an active infection. Go home, he was told. You're fine. Searight knows he is not fine.